So today we are discussing different IVIG brands. Do you know how many brands of IVIG there are? Or SubQIG? Do you? Let's talk about it. So today we are, as I said, talking about all the different IVIG brands. So if your doctor or nurse practitioner has recently prescribed IVIG for you and you've done a little bit of research, then you know that there are many different IVIG brands out there, and it can get really, really confusing. Really confusing. So today we are going to break down all the different brands of IVIG and go over a few of the key differences between them. But first, I want to clarify that regardless of what brand you find yourself on, all IVIG will accomplish the same thing, and that is to provide a surplus of normal antibodies in comparison to abnormal antibodies that one may have when they have an autoimmune disease or chronic disease like myasthenia gravis, Guillain-Barré, MS, or myositis, or an immunodeficiency like primary immunodeficiency, which just means that you're not making enough antibodies in general. And if you'd like to get into greater depth about IVIG, what it does, how it works, then check out some of our other videos. All right, so let's chat about different brands of IVIG. They are Gamunex, Gamaplex, Gamagard, Panzyga, Privigen, Hizentra, Hyqvia, and Cubitru. There are a few other brands too, but these are the ones that I work with on a regular basis. So let's first talk about which brands can be used as either IVIG or SubQIG. And if you don't know the difference, IVIG is antibodies or immunoglobulins that are infused through your vein, through a catheter in your vein. Subcutaneous IVIG or SCIG is infused through needles that are inserted usually by you yourself into the subcutaneous tissue, usually like the belly or the thighs, sometimes the back of the arms. If you want to know more about that, again, check out the SubQIG video. So the brands that can be used either intravenously or subcutaneously are Gamagard and Gamunex. So why would we care about this? So depending on your needs, if you have maybe bad veins or you just need a more convenient therapy and you've been on IVIG and all of a sudden you need to switch, how do we do it? How do we do this? And why would it really matter if you could stay on the drug that you've been on all along and just switch to a different route of administration? So the thing with this is if you've been established on one drug, say Gamunex, and you've been doing great on it, it's working, you're not reacting to it, you're not having side effects or anything like that, and then all of a sudden your doctor wants to switch you. Why wouldn't we want to keep you on that same brand? Because you're doing well on it. So in this case, the pharmacist can actually calculate a dose that goes from IVIG to SubQIG. And it's just a matter of teaching you how to maybe insert the needles and switching up the frequency of that infusion. So those are the two drugs that can be given as either or. Subcutaneous brands only include Hyqvia, Hizentra, and Cubitru. The next thing we're going to highlight is which brands are better for diabetics. And those brands are Gamagard, Gamunex, and Privigen. None of these have any sugar added. So this is a point of consideration for diabetics that may need IVIG therapy. And then the last area we're going to review is cost. So I'll preface this with costs may vary slightly from specialty pharmacy to specialty pharmacy. you know, here and there, they're going to vary. But for the most part, IVIG is a very expensive treatment. And if you watched the video on IVIG, you'll know that the amount of work that goes into IVIG, manufacturing it, drawing blood, collecting it, the personnel needed, you know, it's very expensive. It's a labor-intensive therapy from beginning to end. So this often translates into a pretty expensive therapy. So to give you a ballpark, 10 milliliters of GammaGuard is roughly about $165. Gammaplex is about $94 for 10 milliliters. Gamunex C, $145 per 10 milliliters. And Privigen runs about $160 for 10 milliliters. So you can see this would all add up pretty quickly. You know, if you take a 200 gram dose for a pretty big guy, you can see how costly that might be. Anyway, so to sum things up, IVIG is a life-saving therapy. There are 10 brands in total. Each of these brands has specific components, but deciding on which one is best for you is a conversation to be had with your doctor or your nurse practitioner. And it's going to be based on many variables, you know, what other health conditions you have and what your lifestyle needs are. Do you need to infuse at home? Do you need to be able to do the infusion yourself? Maybe you travel a lot for work. Lots of things go into selecting a therapy. So drop a comment below if you're on one of these brands and let me know what you think of it. If you have any thoughts or any issues with the brand, or if you have any specific questions, and I will do a separate video if I get enough questions about one topic in particular. Anyway, I look forward to seeing you in the next video.